Hello people, namaste. Welcome back to my channel. In this video, I will discuss about the another important questions from the university exam from the lesson of metallic poison. Previously, I discussed about the mercury and arsenic poisons. Now, I will discuss about the lead poison. Okay, lead, lead poison. Okay, it is also called chronic lead poison. Is also called as plumbism. They will ask in write about plumbism or saturnism. Okay, this is the lead poisoning, plumbism and saturnism. Okay, comes to forms. Two types of lead poisoning: organic and inorganic. Okay, organic examples of lead poison: tetraethyl lead, tetra 4, ethyl lead. Okay, tetraethyl lead. Here inorganic is lead acetate and lead tetraoxide and lead sulfide. This sulfide used in eyeliners. This lead sulfide used in eyeliners. This lead tetraoxide is most toxic form and lead acetate is most common. This is used as anti-knocking agent in petrol. Tetraethyl lead is used in anti-knocking agent in petrol. Anti-knocking agent in petrol is tetraethyl lead. So these are the two types: tetraethyl lead, tetraacid, lead acetate, lead tetraoxide, and lead sulfide. Next comes to roots. Roots. How this lead in children is accidental. Children, oral, accidental. Adults comes to adults, it is inhalation. Inhalation form like occupation like plumbers, painters, polishers. Plumbers, painters, and polishers. All these are roots. Next comes to clinical features. It is very easy. See, like clinical features are very easy. A, B, C, D, E, F, G up to G. See, first one is A. A means anemia. A means anemia. Anemia, which type of anemia? Microcytic hypochromic anemia. What this lead inhibits? ALA dehydrogenase, ALA dehydrogenase and ferrochelatase. Because of inhibition of ALA dehydrogenase and ferrochelatase, there is increasing of ALA level and protoporphyrin. Because of ALA and ferrochelatase, because of inhibition of these two leads to increase in ALA and the protoporphyrin. This is the anemia. A means anemia. Next comes to B. B means Burtonian lines. In previously I discussed about the Mees lines. Mees lines are present in arsenic. Here Burtonian lines. These are the lines. These are the blue deposits. Okay, these are the blue deposits over the gum. Due to lead sulfide. These Burtonian lines present at the gum. These are the blue deposits. Okay, blue deposits present over the gum due to lead sulfide. Next comes to another B. First one is Burtonian lines. Next one is basophilic stripling. Basophilic stripling is seen in RBC. See, RBC reticulocyte is present, which is converted into the mature RBC. Mature RBC. Because of inhibition of this enzyme by the by the lead, because of inhibition of 5-pyrimidine nucleosidase. 5-pyrimidine nucleotidase because of the inhibition of this enzyme which converts reticulocyte into mature RBC by the lead leads to basophilic stripling of RBC will be occur in this because of lead poisoning. So I discussed A means anemia, basophilic stripling, and Bartonian lines. Next, another B is bone lines or lead lines. Bone lines are lead lines. This is radiodense metaphysis of long bones. Long bones have radiodense. Radiodense, generally seen in children. Okay, these are the three B's: Bartonian lines, basophilic stripling, bone line, and lead line. Next, come to C. C means colics. Colics means generally painters or Saturine colic. Generally, nocturnal pain is present. Nocturnal pain is present. This for one of the C is colics. Next comes to constipation. Another C is constipation. Constipation. Next, another C is cardboard ring. What is cardboard ring? Means a figure of 8 in RBC. RBC in the shape of 8. Cardboard rings, colics, and constipation. These are the 3 C's. Okay. These are the 3 6. Next comes to D. See, it is very easy. Comes to D. D means drop. Which drop? Wrist drop and foot drop. Wrist drop and foot drop. Okay, wrist drop and foot drop. Next comes to E. E means encephalopathy. 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 This is generally most affected in children. Okay, F means facial pallor. Facial pallor. This is the first earliest sign. Most common earliest sign in lead poisoning is facial pallor. Next comes to G. G means gout. Saturn gout is present. So these are the A, B, C, D, E, F, G. A means anemia. B means basophilic stripling, Bartonian lines, and what is that? Another B is bone line or lead line. Next comes to C. C means colics, constipation, cardboard ring. Next, D means drop, which to drop, fruit drop. E means encephalopathy. F means facial pallor is the most earliest sign. Next, G means gout. Next, after that, laboratory findings. Laboratory findings. Laboratory findings like peripheral smear. What we see under the peripheral smear and serum, blood, and urine. Serum, blood, and urine levels. Okay. See, in blood or urine, we can see the lead level and erythrocyte, free erythrocytes, ALA. I discussed previously, no, ALA will be increased and protoporphinols and will be present increased. So we can see this increased lead level, increased protoporphyria, increased ALA. All these are increased in urine and blood level. Next, peripheral smear like I discussed previously, like anemia, microcystic hypochromic can be seen in peripheral smear. Next, polycythemia, polycocytosis, anisocytosis, all these are present in peripheral smear. Polycocytosis. Next, anisocytosis, basophilic stripping, cardboards ring. So these are the laboratory findings. Okay, laboratory findings. Next comes to radiological findings. Radiologically, what you can see in lead, radio opaque lead lines, radio opaque dense, radio opaque deposits in GAT also. Radio opaque deposits, all this can seen in the radiology. Now lastly, treatment. Treatment means DMSA. Here EDTA is used. EDTA, DMSA. I discussed previously encephalopathy symptom, no, clinical feature of this lead poisoning. In encephalopathy, we can use EDTA plus BAL, BAL. EDTA is a common. Okay, EDTA, BAL is used in lead encephalopathy, but normally EDTA or DMSA used in lead poisoning. So this is the lead poisoning. See, Lead poisoning. This is metallic lead. Chronic lead is called plumbism or saturnism. Organic, inorganic, tetraethyl lead, lead acetate, lead tetroxide, lead sulfate. Children accidental, adults occupational, ABC anemia, microcystic hypochromic because of inhibition of ALA dehydrogenase ferrous oxide leads to increase in ALA and protoporphyrogen. Buttonal lines, blue deposits on the gum. Next comes to the basophilic stripling. From reticulocyte to mature RBC, there is a 5 permanent nucleoside. Because of inhibition of this enzyme leads to the basophilic stripling of RBC. Next, bone line, lead lines are present in the generally metaphysis of the long bone of the children. Colic, C means colics and constipation and cardboard strings. D means wish to drop and fruit drop. Encephalopathy. E means, F means facial pallor, most common earliest sign. And last G means gout. What is the laboratory findings? Like peripheral smear and the CMC in the blood and urine, the lead lines, protoporphyrogen, ALA, microcytic hypochromic, polycythemia, polycytosis, anisocytosis, basophilic stripling and cardboard string. Radiology, lead line and radio opaque in the GAT. Whole body lead burden also can be seen in the X-ray finding. Treatment is DMSC, EDTA, but in lead encephalopathy we can use EDTA along with the BAL. Okay, this is the video of metallic poison of lead. Thank you. Please subscribe my channel. Please support us. Thank you.